Good morning, everyone. I'm Dr. Hajira Fathima from Naseem Medical Center, Searing Road, Doha. Today we are here and we are going to speak about celiac disease because this month is dedicated as Celiac Disease Awareness Month. It's the month of May. And with us today is Dr. Syed Adnan. He's our specialist gastroenterologist, and he will be shedding some light on this very pertinent issue that is prevalent in our society. And first of all, I'd like to welcome Dr. Adnan.
Thank you for having
for
me.
being here.
Sure.
And for helping us out in creating awareness about this very important topic.
Sure.
Let's begin by talking about celiac disease. What is celiac disease, doctor?
So celiac disease is a chronic inflammatory condition of the small intestines, which is triggered by a protein which we all ingest. It's present in wheat, barley, rye, and a lot of pulses, and which is called gluten.
Yes.
What this does is it acts as an antigen and triggers an immune response, wherein God in His infinite wisdom has given all of us in our small intestine multiple villi. So these are finger-like projections in our small intestine which are meant to increase absorption of our nutrients. Now what this gluten does is it creates an inflammatory response and it destroys these villi. So it leads to long-term effects such as malabsorption and multiple vitamin deficiencies and stuff. So this is what celiac disease encompasses.
What are the presenting symptoms of celiac disease?
Yeah, so celiac presents with a variety of symptoms. About 1/4 of the time, people can present with abdominal bloating, dyspepsia, abdominal pain. But a lot of times it is silent as well.
Yes.
And sometimes it can present with uncommon symptoms such as osteoporosis, which is weakening of their bones. It can present as iron deficiency anemia.
Yes.
It can also present with infertility and stuff. So people can present with a variety of symptoms, and unless people are aware of this,
Yes.
then they wouldn't seek testing for such a diagnosis.
Yes.
So it is important that we understand that celiac disease doesn't always present with abdominal symptoms. It can present with a variety of features as well.
So essentially what you are saying is that people who are suffering with similar symptoms and diseases which you have just mentioned,
Sure.
and who have seen relapses and frequent recurrent issue persisting should probably consult a doctor and get it diagnosed.
Absolutely correct. I think it is very important and pertinent that if you suffer from any of these uncommon symptoms, especially of celiac disease, then you ask your physician to test
Yes.
for these conditions, because it is a very easy test, which is called a tissue transglutaminidase antibody.
Okay, so this is a blood test.
It is a
correct?
blood test.
Yes.
Yes, of course. So it's a blood test that we can do. It's a very sensitive test. It's about 90 to 95% sensitive, and which gives us a indication whether the person suffering from that condition has celiac disease or not.
All right.
Sometimes when the diagnosis is a little bit tricky, so to say, or not straightforward, we end up doing an endoscopy and taking biopsies from the small intestine.
Yes.
That kind of confirms whether the person or the patient is suffering from celiac disease.
That would be the next step in
Absolutely.
the diagnostic.
Absolutely. But more often than not, a tissue TTG or tissue transglutaminidase antibody will be good enough to make a diagnosis, or at least help in reaching a diagnosis.
This, I feel the fear of the unknown is more alarming than the actual disease.
Agree.
So if that you have elaborated the actual diagnostic procedure, I hope that offers a lot of clarity to people who are suffering from this similar symptoms or ailments which are linked to celiac disease.
Absolutely.
Now, doctor, the thing is, there are a lot of people out there who believe that celiac disease is not really that big a deal. What is your expert opinion on this?
Well, that's a myth. First of all, because celiac disease is very underdiagnosed.
Yes.
Only 5% of people who actually have celiac disease ever reach a diagnosis.
Yes.
And The problem with that is there are a lot of patients who are undiagnosed, and it leads to long-term effects in in these people, including severe vitamin deficiencies,
Yes.
long-term osteoporosis,
Yes.
as well as it's a risk factor for intestinal cancer as well. So it's very important that people get tested if they think or if there is a suspicion of celiac disease.
Yes.
Yeah.
Especially the patients who've been suffering from similar
Absolutely.
symptoms from
Absolutely.
a long duration,
Absolutely.
and who've never been evaluated for that.
Sure.
They're pretty much the main people who should be tested for
Absolutely.
it. Absolutely. And another thing that is very common these days is that people have started following these fad diets,
Sure.
where they feel that going gluten-free and having gluten-free food is healthy, very good for their health.
Yeah.
What would you say about that?
Yeah, that's a good question. Now, thing is, gluten-free diet has become such a fashionable thing
Yes.
to do, and unfortunately, most people are following that without ever reaching a proper diagnosis of either celiac disease, or there's another component of celiac disease called gluten sensitivity, wherein people are not completely having the celiac disease,
Yes.
so to say. Their villi or the small intestine is okay, but they are sensitive to gluten. And that is a diagnosis as well we can make. But without a proper diagnosis, when you adhere to a lifestyle which involves taking gluten-free diet, especially for a long time, then that leads to long-term complications. And multiple research has shown that people who follow such a diet, because that diet is high in carbohydrates, they are prone to insulin resistance, prone to obesity and metabolic syndrome, as well as have a long-term risk of several deficiencies, including B vitamins and minerals as well. So it's important that if somebody thinks they have a gluten sensitivity or celiac disease, then they seek specialized care, get themselves tested, and then follow that diet if it is necessary, instead of just following it as a fashion or something.
Of course, that sounds like the most practical and the most effective approach to be taken. So that was really wonderful. A lot of insight into celiac disease.
Sure.
I am sure it's going to benefit a lot of our patients, a lot of people watching this video, and I hope it helps in promoting good health, and that people who suffer from any of these symptoms, or who have been suffering with the outcomes expected from these symptoms and from celiac disease, would seek the help they need. So it's as simple as visiting us at Naseem.
Sure.
Yes, and any of you suffering from this, and if you have concerns about this, raise the concern with your doctor.
Absolutely.
We can completely help you in getting the treatment that you need. And we have experts like Dr. Syed Adnan available with us.
Thank you.
Who can also help diagnose the cases which are tricky to diagnose, the ones who don't turn up on the antibody test.
Absolutely.
Absolutely. Thank you everyone for your time, and thank you so much, Dr.
Thank you for
Adnan,
having me. Thank you
for the wonderful detailed discussion on celiac disease.
Thank you.